Hi, welcome back to Student Nurses Success. We're going to start a series on the integumentary system or skin disorders. But on this first part, I'd like to talk a little bit about some basics with regard to skin and the integumentary system. Now, remember, you can find a link to the maps in the comments section. Let's go ahead and get started. So I'd first like to talk about what is the structure and the function of the integumentary system. And I have a little picture here. I got this off the CDC website. And really, the primary function of the skin is for protection. And the skin includes the nails, hair, and the glands as well. So it's not just the skin, but it's all these structures that arise from the skin. One of the main things beyond protection is regulation by cooling. And our eccrine glands or our sweat glands really help us with that process. And you can kind of see where they're located kind of right in here. We also have sebaceous or apocrine glands, and those secrete oils and they open up into hair follicles. So those sebaceous glands are kind of right in here, and as you can see, they give rise and they exit through the hair follicle. Now, there are three layers of the skin. You have the epidermis, which is this top layer. You have the dermis, which is this middle layer where a lot of our structures are. And then you have the hypodermis, which is this very bottom layer. There are some age-related changes and some things that you should consider when looking at an individual's skin. First of all, skin tends to reflect age, and that's more so the case with regard to sun exposure. When someone has a lot of sun exposure, they actually might look older than what they are because sun is really hard on our skin. The sun thickens areas of our skin and it also decreases the elasticity or the health of the skin. So, someone who stays out of the sun is going to have younger, healthier looking skin than someone who maybe perhaps has to work in the sun or they spend a lot of time in the sun. We know that as we get older, the epidermis and the dermis both thin and have decreased strength and decreased elasticity with age. Now, young children and the elderly, those two opposite age spectrums, have fewer sweat glands. So that puts both of these at risk for cooling issues. So older adults may not be able to sweat and cool themselves as easily, and young children as well. I'd like to talk a little bit about assessment of the skin and evaluation. It's super important to gather a nice, well-rounded history. Now, that's important in all areas of assessment, but with regard to the skin, you want to ask about occupational and sun exposures, and also what types of activities do they like to do? Are those activities ones where they spend a lot of time out in the sun? Sun, again, is going to age the skin quicker and it's going to increase their risk of cancers. Also, any lesions or injuries, you want to go ahead and get some information regarding where they're located or their distribution, the size, the symmetry, the color, and the shape of them. And you want to clearly document all of this because we are going to look at changes in these. Sometimes we have moles or different areas of the skin that might have a lesion or an injury that would change, and we would need to know that. We also want to look at the number and again, the distribution. Let's talk a little bit about the terminology that we want to use with this. Now, we have primary lesions, which are lesions that actually arise from previously normal skin. So they are not secondary or due to something else. They're just arising kind of on their own. And you should be familiar with the language here and terminology. Macules are flat and they're less than a centimeter, whereas papules are raised and they're less than 5 millimeters. A nodule would be raised, but it would be larger. So it would be greater than 5 millimeters, but less than 2 centimeters. Once it gets over 2 centimeters, then we're looking at things more in the line of tumors. A plaque is a scaly raised area, and sometimes it may be red. A wheal is raised, pink, and swollen. And the thing about a wheal, it's usually from an allergic reaction. It changes abruptly. It can literally change shapes before your eyes. A vesicle is a fluid-filled, like blister, that's less than 5 millimeters, where a bulla is a blister or fluid-filled that's greater than 5 millimeters. So it's much larger. So both of these are blisters, would be a common term for them. A pustule is filled with purulent exudate, and we see pustules with acne sometimes. We also have secondary lesions. Secondary lesions arise from other diseases or conditions. So they may be from scratching or something like that, even. An erosion is where it's kind of erodes or loses that epidermal or that top layer. So it's a little ulceration. An ulcer is the loss through the epidermis, but it scars. So it's an erosion that's larger and it's probably going to leave a scar. Fissures, which is a split in the epidermal layer, sometimes that's from dry cracking types of conditions. Atrophy would be the thinning. An excoriation is the loss of the outer areas, so maybe like a scrape. A crusting is a collection of serous exudate. We'll see this with impetigo or maybe some types of infections. A scale is a thickening or layering of the stratus corneum, which is the top layer of the skin. Lichenification is a thickening of the epidermis. A scar would be a fibrous replacement of the epidermal or dermis. So it's actually filled in and changed so the skin looks different from an injury. And a keloid is a scar that's much larger. It's almost augmented and overgrowth. Some individuals actually develop more keloid scarring, and that's just part of their makeup. Last, manifestations related to the skin. Often patients complain of pruritus, which is known as itching, xerosis, which is dry skin. They may have a rash or a temporary eruption, so like a discoloring of the skin. They could have a lesion or a change in the tissue, so the development of something. It could be reddened or erythematous. It could be hemorrhagic or purpuric, meaning there's bleeding, either bleeding out of the body, out of the skin, or maybe bleeding or leaking of blood under the skin, which would be more purpuric or even petechial. And then lichenification, which is a thickening or a roughness. So there you go. There's just some terminology to be familiar with. Remember to tune in to the other maps in this series. There's a few more to go, and we'll cover all of our dermatologic or integumentary disease states.